And of course, a special welcome as always to Dr. Taleb Rifai. I don't think Taleb needs any introduction. He's the chair also of the Project Hope. And Dr. Taleb Rifai was the Secretary General for the United Nations World Tourism Organization for 7 years. And he's joining us from beautiful Jordan, and is involved in quite an interesting activity, what I think we may be able to introduce to all of you and to see how this fits in your neighborhood, or if it's a good idea, or if it's not a good idea. If it is a good idea, we will actually put a discussion forum on this website in a day or so, so we can discuss it further, and anyone who wants to get involved in it, what is tourism, what is corona-free or corona-safe zones, can be part of this internal discussion. It doesn't have to be Zoom calls, but maybe we can contribute with specific information, consulting, and other things. After Taleb, we have Vijay, and I'm so sorry, Vijay, I don't want to mispronounce your name, so I'm not going to say your last name. It's like my name, people cannot remember it unless they're German. But he's joining us from Singapore. Vijay was a former VP of Etihad Airways and has his perspective on national airlines, what I think is also quite interesting for many of you to hear. Welcome, Taleb, and we're excited to learn more.
Thank you so much, Stein. It's very, very kind of you to introduce me this way. Thank you so much, and good morning, good afternoon, good evening, anybody around here. I'm going to be talking about so-called corona-safe zones. Now, in the previous week, when we came up with Project Hope, we identified 4 main pillars of that project. Number 1 was domestic tourism, domestic and regional tourism. But our emphasis on domestic and regional tourism must not distract us from the importance of keeping possibilities for international tourism open. It has, however, become clear that people are not going to just leave home today and travel, even if it becomes possible to do so. After Corona crisis, the technically is over, unless they feel safe and secure. Today, the psychological barrier is one of the most important factors preventing people from leaving home, let alone traveling to another country, especially for leisure, or when there is no real urgent need to travel. The feeling of being safe and secure, which is essential for travel, must, however, be by real safety and security measures, but must be complemented by real safety and security measures on the ground for any particular destination. I'm trying to attempt here to describe this design, so-called Corona Safe Zones, CSZ, at any destination. So what is the CSZ mean? Why is it important? What are the criteria, and how do we choose CSZ? How do we decide on what procedures need to be implemented? How do we verify the right implementation of such procedures? And how do we market such a zone? These are all important questions. I'll try to answer them as quickly as I can. What is CSZ? Why is it important? When we say Corona Safe Zone, we must recognize that there is no one personality that can guarantee 100% Corona-free zone. We can, however, surely implement all necessary procedures to assure everyone that we are doing our best, doing all that we can to ensure safe and secure environment. That's very, very important. That is why the act of doing the right thing in saving people's life is as important as feeling, and the perception of safety, security is created in the minds and hearts of people and visitors. CSC is important, therefore, not only because we are doing the right thing, but because we have people trust and believe we're doing the right thing. Credible and positive promotion is a very important factor. That's the whole idea. How do we choose CSC? Any zone can become a CSZ zone as long as it is a zone that has geographically defined and specific entry and exit control points. You can't just declare any place. So the islands are very, very important, for example, in this regard, because they're very defined and very secure. The zone should perfectly include specific airport or port. It should dedicate this airport or port to the service of that zone. The zone should include defined, well-managed accommodation. transportation and retail facilities and services to the particularly natural and cultural environment. The zone should preferably be independent administrative zone forming a recognized economic entity. Now, how do we decide on what is necessary for procedure? The idea is based on the following, following and taking care of each and every visitor in a detailed movement. The moment they arrive to the time that they leave back, we have to follow these visitors from the moment they leave their homes to the point that they come back to their homes. As an example, a family arriving to a corona safe zone, they have to be tested before boarding, preferably on the national carrier of the country of that zone, because they have to be responsible from their destination of origin. Secondly, the airport at the destination origin will have to be very well managed, so on and so forth. All employees at the airport must be dressed appropriately according to certain protocols. Lounges at the airport must be observing social distances and all other medical security. Embarking on the aircraft must follow social distances. The aircraft itself must be carefully sanitized at least 1 day before the flight, and seating must follow certain rules. Hostesses, workers on the plane, flights should preferably be non-stop flights to avoid complications and stopovers. Disembarking at free safety zone arrival must follow the medical procedures. When disembarking, the arrival, safety, security, immigration, and all other testing and luggage collection must be controlled, so on and so forth. I don't want to go into details of this, but what we need to do is we need to make sure that all what we are doing is according to certain protocols. That's very important, otherwise we will lose everything. Now, these are but some examples of a large number of protocols that need to be designed. Specific protocol will have to be drafted by medical and specialized operational and management experts for each and every step along the way. The duration, the stay, as well as any other protocols needed. Tour operators, airlines, airport managers, local transport vehicles, and buses, hotels, retail shops, ecological and natural sites, managers will all have to commit to proper implementation of all protocols. They should all embark immediately on retaining their staff to properly implemented and protocols, whether it's cleaning, sanitizing, wearing all the right protections, or testing when and where needed, all of which can be administered and supervised by today's tour operators that find themselves out of work. This will bring back all tourism operators to work. The ability and the adherence to these protocols should be certified by a credible specialized body. It's important not only because it is the right thing to do, but also because it's the only way of communicating trust and confidence to the consumer, to the customer. It is the only way of alleviating the fears and worries from travelers and the necessary trust needed for them to leave their homes and travel. Airport, airlines, taxis, buses, hotels, and selected sites will have to be certified and display their certification clearly to everybody. The sum of all of the above would lead to a general overall certification, certified Corona safe zone. Now, we indeed need to use the concept of certified Corona safe zones for promotion and marketing. So for example, I did speak in an earlier session on Greece from home. Can now become Greece. It's time to leave home. Greece is ready to waiting for you. Come to Greece, the island of Mykonos, Greek island of Mykonos, certified corona-free zone, so on and so forth. It's time to leave home. Come visit Jordan. It's ready and waiting for you. Come to Aqaba, Jordan. It's certified corona-free zone. We'll visit the Dead Sea, Jordan. It's a corona-free zone. All of these titles could be used for promotion. It's important to note that while we may look like expensive investment for some, that is seen by some being temporary after all, which this endeavor is all about. But even if some protocols and restrictions would ease up in the future, the fact remains that things will never go back the way they were. And even so, the hesitant state of mind will remain in the heads of many people. The world will never go back. So it's a worthwhile investment. Governments must lead stimulating and stimulate generally overlook this concept. But it is the partnership with the private the design of this protocols, testing and implementation of protocols, and certification and implementation of such protocols to be realized. This is basically I wanted to describe in a rush and a very, very quick way and a quick manner. I believe that these Corona safe zones are very, very important to start identifying now. Island countries, beaches, complexes, hotels, any identifiable geographic zone can become a Corona-free zone, a Corona safe zone better. Thank you so much.
Thank you very much, Taleb. It's quite fascinating, and it needs, of course, a lot of implementation. So what we will do, we will form a discussion group. Anyone can attend. We will also be trying to look for resources and consult with Taleb from people who can help to implement such a safe zone or such a project. And we cannot discuss this all within 45 minutes or 1 hour, but everyone who has any input then can use this feedback also, so we can make it interactive and actually also provide resources to bring this to the next step. If there are any questions, please feel free to raise your hand, and there's a blue hand on the right side of your screen, and then we'd be happy to let you ask your question. I'm wondering, I don't see any blue hands yet, but we'll be watching for it. I know a little bit earlier I talked to Dov, and Dov is running a consulting and inbound marketing company in Tel Aviv in Israel, what is in your neighborhood. And I know you have been referring to the free zone in Aqaba. What is it, excuse my ignorance, I'm not too familiar with the politics and with possibilities for people traveling back and forth between Israel and Jordan. But wouldn't this be type of a possible project for regional cooperation in regards to neighborhood tourism, safe tourism? Couldn't that be a good test, for example?
Of course, of course. But we're more ambitious than this. This does not entail flying, because the people from Israel can come to Jordan by car. They can visit Aqaba through Eilat, or they can visit the Dead Sea through the River Jordan, passing the River Jordan, which is less than 45 minutes from Jerusalem. Jerusalem to the Dead Sea is less than 45 minutes. They could drive there, but that is by land. And by land, you need to have this Corona safe zone identified and locked in. We do have that. The Dead Sea area, for example, in Jordan, has checkpoints before you enter that zone, which is important in this regard. So I believe I was going to speak to him today and to convey to him the readiness of Jordan to do that. But that's not what I'm referring to here. What I'm referring is bigger than that. What I'm referring is international tourism, really. Because we have to prepare ourselves for that, even though it's still way ahead.
Right. Okay, we have two questions actually. Two people raised their hand. One is Ruth van Baal. Maybe you can also introduce yourself, say where you are, and then Mona Nafa. Maybe we can start with Ruth. You were first.
Hi, good afternoon, everybody. This is Ruud van Baal from the island of Yap in the Pacific, part of the Federated States of Micronesia. We are indeed corona-free, but the question is, how do you convince the government to allow people coming in from countries, territories that still have confirmed cases of corona? It's a big fear here to let people in from those countries.
Okay. My suggestion is very simple. You have to check and test people before they board the plane to your country, to your destination. That's part of the protocols that must be observed. Ideally, it's the best to have your national carrier do that. Even if your national carriers cannot do that, you can make an agreement with airlines that they must be tested before they're on the plane. So they don't enter your country unless you're 100% sure that they're good. And even when they come to your airport, you have to test them again before they enter the country. So it's a matter of testing and then certification. Certification will be on the procedure that you have done. Did you do it right or not? Certification is the job of many, many international organizations that are so qualified to do this nowadays. This is my answer to you.
Yeah, and Burkhard, from knowing your geographics, because you're right in my neighborhood, and as far as I know, and I may be mistaken, the only international flight is actually United Airlines here from Honolulu, connecting Micronesia. We call it the island hopper. Is this still the only way of getting to Micronesia these days?
Correct, yeah. And then you always have to use Guam. So all the traffic comes in via United, via Guam, and only originally two flights a week. But right now we don't have flights at all.
That makes it easier. Makes it easier, well, because you, yeah.
My question to you is this testing that you refer to already available? Because as far as I know, it takes a couple of days to get the results after you did the test.
Not anymore, not anymore, my dear. I think you're having some problems in the United States because of mismanagement and misadministrating these things. The tests now are done on the spot, and they take half an hour, 45 minutes to come out. So you can do them at the airport before anybody boards the plane. Nobody should board the plane if he is suspected of being corona infected.
All right, well, that's great. Could you share that information with us?
Of course, with
because
pleasure.
Everybody here on island believes it's the only way to survive this crisis is to be in a lockdown and have no people coming in and going out until the rest of the world.
You can't live like that forever. You can't live like that forever. You know that.
I know, but
okay.
I'm not in charge of this island.
That's right.
And Ruud, I think it would be good, I think, if you guys team up with the Guam Visitors Bureau, or even here with the Hawaii Tourism Authority and United Airlines. Maybe you can actually revolutionize how traffic is in the United States, even though you're an international destination. But the testing, the way Taleb has been describing it, and like I know Emirates Airlines is doing it, for example, is simply not available here in the United States, and for flights going out of the United States. And in order to go to Micronesia, you have to go through the United States, either through Guam and Honolulu. So it'll be an interesting way of maybe from your government side to rate to United Airlines that this is the monopoly in and out of your region.
Yeah. Well, it would be great if we can get access to that information, and I'll share it with the people in charge here. That would be
with pleasure. With pleasure.
It would be a great start.
Yeah, we try to make this available. Thank you very much. We have a number of other people. Mona Nafa, and I can introduce Mona. She's also from Jordan, and she attended also our meeting. It was probably very late for her last time. Now it's early in the morning. Good morning, Mona.
Good morning. I am a morning person.
Good morning, Mona.
How are you, Taleb? Good. My neighbor. Sabah Noor. Thank you so much. It was a very insightful and positive way to start. We need to start the trend of getting back into the tourism mode. I wanted to comment, as a marketer, I heard from some Western marketers that using Corona in any tagline or marketing campaign could be a negative connotation. I like Corona safe zone, because we can't assure anybody that it's a free zone, in my opinion.
Right.
What are your thoughts on using the word Corona in a marketing campaign? And though I believe we have to test many formats, we test and learn. This has never happened before, so we are really at a baseline level where we have to try many different campaigns to stimulate the confidence in travelers to come back out and visit sites. Though, as you said, locally, regionally, then internationally. So I wanted to share this with the traveling community. What sort of taglines will tourists feel comfortable with either mentioning Corona or not mentioning? And then also, I also wanted to touch on source markets who are in a good position, like Jordan. Those could be the first markets we could try to tap, such as South Korea. When two countries are in a good position with their Corona management. thoughts.
Okay, let me respond to that very quickly, if you don't mind. Now, I agree with you, corona-free zone is a bit too much because it conveys the message that you're free, you're guaranteed. There is no guarantee to this. Like when you fly an airplane, there is no guarantee this plane is going to reach where it does. But you have all the assurances that the safety and security measures are taken. So corona safe zone is better. Now, why do you have to keep corona? Because it's what marries people. If you don't try to avoid this situation. I mean, if you have a problem, I believe that you should confront it upright. You should tell people that corona, if you're afraid of corona, corona is safe here. It's not, you scare them with that word. To the contrary, you reassure them by using that word. That's my belief now. I'm not a communication person, but I think that the use of the word corona is not bad here. That's what I'm saying. Thank you.
Thank you very much.
Sure, thank you.
We have Denise Aliong Thomas. Denise, where are you from?
Yes,
welcome.
Good morning. It's morning here in Trinidad and Tobago, 2 a.m.
Okay.
I am Denise Aliong Thomas. I'm the president of the Small Tourism Accommodation Owners of Trinidad and Tobago. We represent the small accommodation properties with 1 to 20 rooms. So those are the B&B, self-catering, and host home properties. I would like to make a suggestion, but it is also a question to find out to what extent the World Health Organization and the Center for Disease Control will be a part of this whole idea of corona safe zones. I'm not sure if tourism is represented at all on that body. Maybe someone else can speak to that, but it might be a good idea to throw out this idea to the both organizations. And in the Caribbean, for example, we have the Caribbean Public Health Agency that covers the Caribbean territories. And I know that the Caribbean Public Health Agency, they are in the process of developing policies and so on for the Caribbean region. However, I would think that rebuilding tourism can probably approach the World Health Organization and the Center for Disease Control to see how they can assist not just with building the this initiative, but also in terms of funding, for example, particularly for our industry, because our industry, tourism industry, is quite special if you want to look at it that way. So that's just a suggestion for the World Health Organization and the Center of Disease Control to assist with this initiative. Thank you.
Thank you so much. Look, may I just respond very quickly? I used to work with the UN system. I know how it works. The World Health Organization will welcome something like this, as long as you stick to their protocols. It's the word protocols that really matters here. So if for example, you're sticking to the fact that every place you go, you're sanitized and you are tested, or that you're certified by doing that, then the World Health Organization would support us. However, the World Health Organization is not a funding organization like all the other UN organizations. We have to go and seek funding for this somewhere else, because what you need to do is not just put these systems in place, these protocols in place. You have to certify them. That costs money. You have to train people to do this, because people are not used to do this. People that work on airplanes are not used to clean them the way they're cleaning them now, for example. They're not used to present food the way they should present it in accordance to a certain protocol. So I think it's a very good idea to approach the World Health Organization, but we should approach them on the technical matter. They should be certifying, they should be approving these protocols. That's basically what their job is. They'll be very happy to do that. I know that.
Perfect.
Thank you.
Thank you very much, Taleb. We have 2 more questions, and then I like to go, if possible, to Vijay, because we're a little bit over the first half of our session here today. But there's Vincent and Deepak. Vincent was first, and as far as I remember, Vincent, you're calling us from Uganda. Is that correct?
Yes, that's correct.
Good morning. Welcome.
Good morning, Vincent.
Thank you so much. Good morning. Good morning. Now, I agree with you about the testing. It's important that a lot of testing is done. However, I don't know how it will be managed. I may leave Uganda and I'm going straight to Micronesia. I leave my country, I do the testing at the airport, it's negative, but there's no direct flight. So I have to go through 2 or 3 other airports. And somehow along the way, I get infected. But that will not show even on arrival because under 4 days, nothing may show. Wouldn't that still bring in the risk that I will end up taking, somebody will end up taking the infection into Micronesia? And shouldn't we rather be looking at the fact that maybe as much as we cannot live in lockdown forever, we may need to prepare to live with coronavirus for some time until a vaccine is gotten?
No, I'm not promoting that at all, Vincent. What I'm saying is the following. We should start international tourism somewhere. We should start by declaring some corona safe zones. We should start by direct flights only. That's what I suggested there. I think any stopover would complicate matters a lot. I'm not saying that you could travel anywhere you want. I'm saying there are specific routes, specific areas that you should travel to. Only these areas that declare themselves safe zones, and only the places that you could reach direct. I'm not saying you could go to Micronesia now, but other people from the States can go to Micronesia if they have a direct flight. We have to start somewhere. That's what I think. And then we can complete the cycle when things are behind us. That's my proposal.
And that might be a good answer also for Vijay. Maybe he's already, he will be already talking about it, and keep that in mind. I'd like to go to, before we go to Vijay, to Deepak, right? Joshi, Deepak was the CEO, the former CEO of the Nepal Tourism Board. Namaste. Welcome, Deepak.
Namaste. Namaste, Dr. Rifai. Namaste, Jorgen.
Namaste.
Just one thing. In Nepal, regarding safety protocol, we are doing 3 things. One is we have identified different sectors and then have drafted one checklist for safety protocol. And second thing is we are doing a kind of training to all the stakeholders, the frontline officials. And third is we are going to form one mechanism also to monitor this, one from government officials, one from private sector, and one from tourist police. So one thing is we are doing this right now. And then another thing is market-wise, domestic market, regional market, then short-haul market, then long-haul market. This is the priority we have identified. And then the segment-wise, domestic, and then the niche segment, because the niche segment have a strong desire to travel, and then business and corporate segment, because in business segment also they have compulsion to travel after Corona. And fourth segment is pilgrimage segment, because they have a strong belief. So is this the right way to go, or if you want to give some feedback for us, Dr. Rifai?
Thank you so much, Deepak. Always good to talk to you. Now, what I'm saying is the following. We should concentrate on domestic tourism and then regional tourism, that's for sure. Then if you want to venture into international tourism, that's what I'm saying. You should start with identified zone. I'm not saying that all of Nepal should be Corona safe zone, all of Jordan, all of whatever it is. You should identify certain zones, certain areas, a beach, a mountain hill, something like this, an area geographically that you could control. Islands are very, very good to start that typically, because islands are very well defined, but you need to have an airport in that island or a port where a ship can come. I don't understand why ships now are banned. I think the cruises are very disfortunate that they had so many stories associated with them. Ships should be sanitized immediately now. I think a ship is like a floating island, and an island can be controlled if it's serious. The important thing is to take things seriously, to really do our jobs seriously and certify them. Certify them means you're supervised, like you said, by more than one party. Thank you.
Thank you. Thank you very much.
Thank you.
Thank you, Deepak. Now,